This is One-on-One. Dr. Amit Trivedi is attending surgeon, Department of Bariatric and Laparoscopic Surgery at St. Joseph's Regional Medical Center. Good to see you, Doctor.
Good to be here, Steve.
We're doing this program in May of 2013. Interesting time. Governor Chris Christie has announced to the world, the world seems to be interested in this subject, but this subject will be interesting to a lot of people after this, that he has had a certain procedure done, and that is a lap band procedure?
Right. He's had lap band surgery to help him with his weight. He's been struggling with it for many years, as you know, and as he's publicly said. And he's come to the point where he felt he needed a surgical solution to his weight.
Why don't we do this? Explain to folks, as our cameraman Steve Barcy comes in on this, exactly what you're showing us.
So these are the actual lap band products, okay? And there's two companies that make a lap band or a gastric band product. One is the Realize company, which is this one, and the other one is the Lap Band company, which is this one. And they're essentially the same product, similar to a Coke and Pepsi type thing, okay? And basically what a lap band is a belt buckle with a balloon that's inflatable on the inside.
Got it.
The balloon is adjustable through this tubing, and this tubing is connected to a fill port, and the fill port is placed underneath the skin in the convenient location. So right in the office, the lap band can be adjusted. It's placed laparoscopically through a couple of tiny little incisions in about a 40-45 minute procedure around the top portion of the stomach. And what it does is it partitions the stomach into two little segments. One is an egg-sized stomach portion, and then the rest is the big portion of the stomach. So as food comes down from the esophagus, it has to fill up this little egg-sized stomach, and before it can go into the rest of the stomach, it's going to have to go through this opening. And this opening can be adjusted right in the office, depending on your appetite, to help you lose weight.
I said something to you before I came in here, that into the studio for this interview. I said, you know, I was running around and didn't get a chance to eat very much, so I grabbed a muffin, okay? And I said, or as a chocolate chip muffin. I'm right, I'll admit it. And I said, you know, I couldn't have this, you know, if I had this surgery. You said, this procedure, you said, that's not an issue because?
That's not necessarily an issue at all. When the lap band is tightened, there's a very small opening in the center, and soft, moist, mushy foods that are usually in high calorie, like muffins, donuts, munchkins, potato chips, milkshakes, will go through the tiniest of openings, and you will not lose a drop of weight.
But the problem is with what kinds of food?
So there should be no problem with any kind of food if it's well chewed.
Someone says, all right, I'm going to go for a big steak.
Right. And that's the classic example of a type of food that will get stuck. Most people don't chew their steak well enough, and if you have a very small opening into the rest of your stomach, the steak's not going to fit through there. And it's going to sit up here, giving you a very uncomfortable sensation. And that's your cue to say, I've had enough and I should stop.
But in and of itself, I mean, the governor, when he did this, made it clear that he knows that he still has a lot of work to do. And by the way, there was a certain procedure he did not get. Let's make it clear. And you've performed both. I think there were 3 procedures, in fact.
There's actually 3. So
What
weight
else?
loss surgery in 2013 is basically refined down to about 3 procedures. The gastric bypass, done laparoscopically, is the gold standard. That's a small stomach pouch and a short circuit of the intestine that helps you lose a significant amount of weight. So that's one. Then there's something called the sleeve gastrectomy. That's where we partition the stomach into a long tube like a sleeve. That helps you eat less, and we actually remove the hunger hormone producing part of the stomach. So those 2 things in combination work beautifully to help you lose weight. And the third is purely a restrictive procedure called the lap band procedure.
But the governor made it clear, and this is not simply about the governors, we're trying to learn as much as we can. The governor has done this, has drawn public attention to it, so we're saying, hey, listen, let's learn about this. The governor said he did not want to have a more aggressive medical procedure. He thought a riskier procedure, which is the...
Right, the sleeve and the gastric bypass.
Okay. He's correct in that.
He is correct in that. The lap band has the best safety profile. So it's fully reversible.
Right.
We're not cutting the stomach. We're just wrapping this product around the top portion of the stomach. And it's fully adjustable, so you can work with your lifestyle.
By the way, what is stomach stapling?
Stomach stapling is a generic term for a whole series of operations like the gastric bypass or the sleeve
But it's not a
gastrectomy.
thing in and of itself.
But it's not a thing in
Okay.
and of itself.
But here's the thing. For Governor Christie and anyone else who has this lap band surgery, what kinds of things do they need to do to have the maximum, the positive benefits outcome that we're looking for?
That's an excellent question. So what I've learned in over a decade in doing this is that it's not just about the surgical procedures. There's a whole component preoperatively, during the surgery, and postoperatively that ensures people's success. Preoperatively, we tend to enroll everyone into a multidisciplinary preoperative teaching and exercise program that helps people lose weight, get into the right frame of mind, learn the proper diet protocol.
What do you mean, what does frame of mind have to do with it?
Food is so ingrained in our culture that if there's changes that are to be made and things that may or may not work, and this transition period where you can't eat everything, that's going to have an effect on you. You don't want someone to say, I had weight loss surgery and I regret it, because the health benefits have been clearly defined for these operations. They save lives. They add potentially a decade to one's life expectancy. So the benefits are clear. We have to get patients to understand what they're volunteering for and give them the best preparation. So in my program, I make sure that they have access to dietitians. I pay for them. They have free access to it. They have access to a psychologist. They have access to support groups if they don't want to talk to physician types. They have access to what we call a rehab program, which is an exercise physiologist that works with them to help design a program for them. Because a lot of our patients, because of their weight, are almost embarrassed to go to regular gyms. So here we have something for them, because we need that.
By the way, you have a relationship at St. Joseph's, but also at
Hackensack University Medical Center.
And by the way, picking the right physician to do this is critical.
These are very technically demanding operations. There's a lot of subtleties to it. You want to make sure that you pick the best technical surgeon for your job, and you got to make sure that you also have a good support system that goes around with that program that you choose. So we've worked over the last decade to refine our program based on a lot of patient feedback and what their needs are.
But someone saying, hey, I did the lap band, I'm good, that's the wrong attitude.
That will never work. So there are concerns, and there are patients that have had the lap band, but they never come in for an adjustment. That will never work. And I'd like to show you an adjustment so that people have a good concept of what it is. So there's a balloon on the inside of this ring. And through this tubing, I can inject saline, which is essentially water, to inflate it. So here I'll inflate it, and you can see how the opening goes from that size to pretty darn small. And if it's too tight, I can loosen it or adjust it to down tighter.
Why would you do this?
To find the right balance. And the right balance actually changes if you get a cold. If food gets stuck, it's easy enough to loosen it.
But you want the patient to lose a certain amount of weight per week, not too much, not too little. What would be that optimal?
Well, we try to produce about 1 pound or 2 a week. Doesn't sound like much, but it's between 50 and 100 pounds in a year. And that's a significant amount of weight that this product can produce.
And if someone's not doing that, you make the adjustment.
Right. So initially, we leave it wide open. Once the swelling from the surgery is gone in a few days, usually we do the first adjustment at the 1 month mark.
Finally, I have to do this. The governor has said publicly he is not looking to be a role model for anyone else. He's looking to do this for his family, for his wife, for his children. Right. He turned 50 in September of 2012, and he wanted to do this for his health, for his family. But is it not a fact that a lot of people looking at what he is doing could learn from this?
That's essentially true. No matter how hard he says that he's doing it for his family, which is very true, he is a public figure.
Yes.
And public figures, whether they like it or not, get looked on as role models in both a positive and a negative way. So people will be watching him.
People will learn from this.
Right. And people can relate to it too. Here's someone who's achieved so much in life, but yet has trouble with it.
And has admitted to struggling with it.
Exactly right. And I'm glad that he was able to do that, because we're finally getting to accept in America that this is actually a disease just like every other, and not a character flaw.
No.
And I think that's an important distinction that we as physicians, you as media, and certainly the governor has to make. It's not a character flaw. The factors that contribute to one's obesity are so multifactorial. You cannot say it's just a character issue.
Dr. Amit,
we treat it as a disease, sir.
Dr. Amit Trivedi, a lot of people may want to just talk about it because it's a topic in the news, but to learn more about it, the complexity of it, the multifaceted nature of the subject is much more important, and you've helped us do that, and I want to thank you very much.
Thank you so much, sir.
Stay right there. Stay with us. We'll be right back right after this.
One-on-One with Steve Adubato has been a production of the CAUCUS Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by Fedway Associates, Inc., the Russell Berry Foundation, Cone Resnick, New Jersey Natural Gas, Verizon Communications, and by the law firm of Gibbons PC. Promotional support provided by the Star Ledger and NJ.com. Transportation provided by Airbrook Limousine. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.